hour, what medication comes at each hour, and so on. Then the following pages show you how these medications are changed as time changes, as you go. How you take a little more, you take a little less, this is increased, this is decreased, and so on. But the basic medications, the ones we use, are outlined and described on page 246 on the right-hand page. And I'd like to go over that and give you a little understanding of what medications they are and why they are used. The top one is thyroid, and right after that is Lugol. Those two go together. I've already mentioned that a very important part of the whole body structure and the defense system and the immune system is the thyroid. The thyroid is a gland that regulates metabolism, also body heat, temperature, also the immune system. Everything hangs on this thyroid, and the thyroid has to function. In order to function properly and adequately, it requires iodine. And many of our soils are deficient in iodine. Now, the U.S. government knew this way back in the 30s, that there are certain parts in the United States, they're called the goiter belts, where people were deficient, the soil was deficient in iodine, and people were deficient and were growing goiters. So the U.S. government very nicely decided they would medicate the entire population with iodine by doing what? Iodizing salt. And they assume that everybody eats salt, therefore if there's iodine in salt, you get the iodine that you need. Great and fine, but salt is a poison. Salt is an enzyme inhibitor, and enzyme inhibitors are also defined as poisons. So if you take your salt to get your iodine, you get your iodine, but you get poison along with it. So since we must cut out salt, and salt specifically stimulates mitosis. What's mitosis? Cell division. In order to get fast cell division on cancer, you have to have salt. So salt stimulates tumor growth. So obviously we have to cut out salt, but we still need iodine. So the thyroid, in order to activate the thyroid gland, the immune system, the burning of the fats, and the activation of the response, the immune response, we need a little thyroid gland, plus we need iodine to give the thyroid the nutrient it needs, namely iodine, because we can't use salt. Okay? So the Lugol solution is iodine. Okay? Next after that comes potassium. And that's certainly also one of the most important single items. The potassium compound, Dr. Gerson made more than 300 experiments before he arrived at this combination. And I have heard, again, Dr. Freeman Cope stating that it is absolutely a genial combination. For various reasons I can't go into, it's too extensive. But the combination of potassium gluconate, potassium acetate, and potassium phosphate in equal parts to make a 10% potassium compound solution helps to get the potassium back into the cells. With the potassium, we suppress the rapid cell division, the mitosis, which is the cancer. We improve the differentiation of the cell, the normal healthy cells, so that these active, useless tumor cells can't grow. We need the potassium. Potassium activates enzyme system, the oxidation, so the tumors can't grow. All of it works in the right direction, as well as it helps activate enzymes to break down and digest and get rid of atherosclerosis and plaque and high blood pressure and heart disease. Also to restore tissues that are sick and damaged, like in asthma and in other problems where the tissue damage, the mucous membranes are dried out and allergic and are not functioning, etc. Potassium is needed for all these functions, as well as I said earlier, for normal muscle function. And if there's not adequate muscle function, you get cramping. And you get leg cramps, and you get cramping intestinally, and so on. You get spasming and it causes glaucoma, etc. Potassium is essential in all of these problems. And I repeat, Dr. Gerson said, the beginning of all chronic disease is loss of potassium from the cell systems. We've got to get the potassium back into the cells. So we give an awful lot, a tremendously high amount of potassium. And now comes the important thing. This potassium compound, this 10% compound solution, the beginning patients in the first few weeks, they get in their 13 glasses of juice a total of 40 teaspoons of the 10% potassium compound. Very, very high amount. And now the doctors scream and yell and say, it's going to give you a heart attack, it causes heart fibrillation, it's going to kill you, it's going to kill you, it's going to kill you. I am happy to report that nobody has ever died of the potassium. I have personally taken it for well over 50 years. The answer is quite simple. Every doctor and nurse, usually in medical school or in their training, is shown an animal that is given a high doses of not potassium gluconate acetate phosphate, but potassium chloride. And those animals go into fibrillation, and if it isn't stopped, they die. And it's all because of the potassium, right? Wrong. It's partly, largely because of the chloride. This doesn't happen with regular potassium the way Dr. Gerson put it together. Okay? There's another thing too. The body has a very powerful mechanism of getting rid of excess potassium, namely the kidneys. And unless your kidneys are severely ill, you're not going to get an excess of potassium under any circumstances. Now we have some proof of that. When we first started the hospital going in Mexico, we were helping the patients to understand what was going on, and we showed them about the potassium compound, and they got the salts, the potassium salts, 100 grams, in a little container, and in order to give them enough of their medication to take home, we couldn't give them 12 or 15 quarts of potassium water, and mainly water, 10% solution, so 90% water, but carrying all of that would have been dangerous and could have broken and would, foolish. So we gave them the potassium compound in just the solids, and we carefully explained to them, and in red on the label marked it saying dissolve in 1 quart of water to make the 10% solution. Dissolve entire contents in 1 quart of water and take as directed. So I got a phone call. And a lady calls me and says, hey, I left the clinic a little over 3 weeks ago, and I was supposed to have 3 months worth of medication, and here I'm already out of potassium. I knew right away what she had done. I also knew about these propaganda about the potassium causing heart fibrillation and death in animals that the doctors learn. So my first question was, well, how do you feel? I knew what she had done. She says, oh, I haven't felt better in my life. Good. Then I said, look, have you got that little bottle of potassium compound in front of you? Sure. Yes, she says, yeah, I have it right here. I said, would you be good enough and read me the label? She says, oh, the label says, dissolve entire contents in 1 quart of water. I said, did you do that? She said, no, I took it straight. So this enormous dose of potassium that we're already giving, she took a 10 times overdose because she didn't have a 10% solution. She took it 100%. And she was fine. No problem. Okay. Unfortunately, no matter how often you tell people and how much you teach them, they will still make mistakes. And this hasn't happened once, it has happened several times. Other patients have done the same thing and have taken this huge overdose of potassium, and nothing untoward has ever happened. No danger. Don't let doctors tell you it'll kill you. It will not. Unless you have very severe kidney damage, there is no problem. Okay? So, please, you can take this potassium, properly diluted. We don't believe in overdosing. Properly diluted, you can take it